What are the key nursing interventions for a patient experiencing an acute exacerbation of asthma or COPD?
Managing a patient in acute respiratory distress from asthma or COPD requires rapid assessment, airway stabilization, and continuous monitoring to prevent respiratory failure. My approach combines prompt clinical action, teamwork, and patient reassurance to ensure safety and effective symptom relief. In one situation, I cared for a 62-year-old patient admitted with an acute exacerbation of COPD triggered by a chest infection. The task was to stabilize their breathing, maintain oxygenation, and prevent further deterioration. I immediately assessed the airway, breathing, and circulation, ensuring the airway was patent and the patient was in a high Fowler's position to maximize lung expansion. Oxygen was administered via nasal prongs at 2 liters per minute, as excessive oxygen can suppress respiratory drive in COPD patients. I continuously monitored SpO2, respiratory rate, and effort, and reported any increasing use of accessory muscles or confusion to the physician promptly. My next action was to assist with prescribed nebulized bronchodilators, salbutamol and ipratropium, and corticosteroids while closely observing the patient's response. I ensured proper nebulization technique and assessed for tachycardia or tremors as potential side effects. I also obtained arterial blood gases, ABG, as ordered to evaluate gas exchange and monitor for CO2 retention or acidosis. Antibiotics were administered as prescribed to treat the infective cause, and I maintained adequate hydration through 4 fluids to thin secretions. Chest physiotherapy and effective airway clearance techniques, such as pursed lip breathing and coughing exercises, were encouraged once the patient stabilized. I reassure the patient frequently to reduce anxiety, which can worsen breathlessness. As a result, the patient's oxygen saturation gradually improved, respiratory rate normalized, and ABG results returned toward baseline. They were discharged with education on inhaler technique, trigger avoidance, and early recognition of exacerbation symptoms.
A patient is admitted with a suspected GI bleed. What are your priority assessments and interventions?
A suspected gastrointestinal GI bleed is a potentially life-threatening emergency that requires rapid, systematic assessment and coordinated intervention to prevent hypovolemic shock and identify the bleeding source. My nursing approach focuses on early recognition, stabilization, and close collaboration with a multidisciplinary team. In one situation, I received a 70-year-old patient admitted from the emergency department with complaints of black tarry stools and dizziness. The task was to stabilize the patient while preparing for diagnostic investigations. My first action was to assess the patient's airway, breathing, and circulation ABC, ensuring airway patency and providing supplemental oxygen to maintain SpO2 above 94%. I obtained baseline vital signs, noting tachycardia, hypotension, and pallor, which indicated possible hypovolemia. Continuous monitoring was initiated using a cardiac monitor, and I established 2 large-bore 4 lines for rapid fluid resuscitation as per protocol. I collected blood samples for complete blood count, CBC, coagulation profile, cross-match, and liver function tests, anticipating the need for transfusion or endoscopy. Strict fluid balance was maintained, and I monitored urine output hourly, as decreased output can be an early sign of shock. The patient was kept nil by mouth, NPO, in preparation for potential endoscopic evaluation. While a medical team reviewed the case, I monitored for signs of deterioration such as increased restlessness, decreasing blood pressure, or ongoing melena or hematemesis. I ensured that emergency equipment, including suction and oxygen delivery devices, was available at the bedside. Emotional support was also vital. I reassured the patient, explained procedures calmly, and maintained a quiet environment to reduce anxiety. As a result, early stabilization allowed the patient to undergo endoscopy safely, which confirmed a bleeding duodenal ulcer. After appropriate medical management and transfusion, the patient's condition improved significantly.
How do you assess and manage pain in a patient who is nonverbal or has dementia?
Assessing and managing pain in nonverbal or cognitively impaired patients requires sensitivity, strong observational skills, and the use of validated assessment tools. My approach combines clinical judgment, family input, and a multidisciplinary strategy to ensure comfort and dignity for the patient. In one situation, I cared for an 82-year-old patient with advanced dementia admitted with a fractured hip. The task was to assess and manage their pain effectively despite their inability to communicate verbally. My first action was to use a structured pain assessment tool appropriate for nonverbal patients, such as the pain assessment in advanced dementia scale. I observed key behavioral indicators, facial expressions, grimacing, frowning, body movements, guarding, restlessness, changes in vocalizations, moaning, crying out, and variations in activity level or social interaction. I also sought input from the patient's family, who could describe their loved one's usual behaviors when in pain. Based on assessment findings and the clinical context, I administered prescribed analgesics, beginning with paracetamol and escalating to opioids as indicated. I ensured accurate timing and titration of doses, monitored for side effects such as sedation or constipation, and evaluated the patient's response regularly using the same behavioral indicators. Non-pharmacological comfort measures were equally important. I adjusted the patient's position carefully, used supportive pillows, maintained a calm environment, and applied warm compresses where appropriate. Reassurance through a gentle tone and touch often helped reduce anxiety-related agitation that can worsen perceived pain. As a result, the patient appeared more settled, rested comfortably, and displayed relaxed facial expressions, indicating effective pain control. The family expressed appreciation for the compassionate care provided.
What specific steps have you taken or are you taking to prepare for the nursing licensure and registration process in this country?
Preparing for international nursing registration requires commitment, organization, and a clear understanding of regulatory expectations. I have approached this process systematically to ensure I meet all professional and legal requirements before beginning practice. The situation began when I decided to transition my nursing career internationally to broaden my clinical exposure and contribute to a high-standard healthcare system. The task was to meet the registration and licensure criteria set by the local nursing council. My first action was to thoroughly review the official guidelines on the regulatory body's website, ensuring I understood requirements related to educational equivalency, English language proficiency, competency assessments, and professional verification. I obtained authenticated transcripts, verification of good standing from my home country's nursing council, and supporting employment references to confirm my clinical experience. To meet language requirements, I successfully completed the OET Occupational English Test with a score above the required threshold, focusing particularly on clinical communication and documentation. Simultaneously, I began preparing for the competency or licensure examination, such as the NCLEX or CBT, depending on the country's process. I dedicated several hours each week to structured study sessions, practice questions, and online review modules to strengthen my clinical reasoning and evidence-based knowledge. I also enrolled in a professional development course on international nursing standards and healthcare culture, which helped me understand differences in patient safety policies, documentation systems, and legal frameworks. As a result, I am now in the final stages of my application, with all required documents verified and eligibility confirmed. This preparation has not only advanced my registration process, but also enhanced my professional confidence and readiness to deliver safe, high-quality care within the standards of this healthcare system.
What research have you done about our hospital/organization and the community we serve?
Before applying, I took time to thoroughly research your hospital and the surrounding community because I believe understanding the organization's values, culture, and patient demographics is essential for delivering compassionate and context-appropriate care. From my research, I learned that your hospital is widely recognized for its commitment to excellence in patient-centered care, innovation, and evidence-based practice. The institution's strong focus on quality improvement initiatives, multidisciplinary teamwork, and ongoing staff education aligns closely with my own professional values. I was particularly impressed by the hospital's accreditations for clinical governance and patient safety, as well as its participation in national benchmarking programs that ensure care outcomes meet international standards. I also noted that the organization has invested significantly in technology and digital health systems, such as electronic medical records and telehealth services, which enhance coordination and continuity of care. Your hospital's emphasis on mentorship programs for international nurses and structured professional development demonstrates a genuine commitment to supporting staff integration and career progression, something I find very motivating as a transitioning nurse. In learning about the community, I discovered that the hospital serves a diverse and multicultural population, including many older adults with chronic conditions such as diabetes, COPD, and cardiovascular disease, as well as families from varied cultural and linguistic backgrounds. This diversity underscores the importance of culturally competent care and effective communication, areas in which I have considerable experience from working in multicultural settings. Overall, my research reinforced that this is an organization that values teamwork, continuous improvement, and inclusivity, qualities that resonate deeply with my own professional ethos. I am eager to contribute to a team that upholds such high standards while making a meaningful impact in the community's health and well-being.
The first few months in a new country and healthcare system can be overwhelming. What is your plan for a successful transition, both professionally and personally?
I fully recognize that relocating to a new country and adapting to a different healthcare system can be both exciting and challenging. My plan for a successful transition is built on preparation, adaptability, and proactive engagement, ensuring I adjust smoothly both professionally and personally. Professionally, I intend to approach my first few months with humility, openness to learning, and structured organization. I plan to make the most of the hospital's orientation and preceptorship program, paying close attention to policies related to documentation, medication administration, escalation protocols, and electronic systems, as these often differ from my previous experience. I believe shadowing experienced colleagues, asking thoughtful questions, and accepting constructive feedback are crucial during the early stages. I will also prioritize developing rapport within the multidisciplinary team, as collaboration and clear communication are essential for patient safety and job satisfaction. To support my professional integration, I will maintain a reflective journal, identifying areas for improvement and setting short-term learning goals, such as mastering the hospital's charting system or gaining familiarity with new clinical equipment. I will also engage in continuous professional development through online learning modules and evidence-based practice updates. On a personal level, I understand that cultural and emotional adjustment is just as important. I plan to build a support network by connecting with colleagues, joining community groups, and participating in cultural orientation activities to better understand local customs and communication styles. Maintaining regular contact with family back home, practicing self-care through exercise and mindfulness, and allowing myself patience as I adapt will help me remain balanced and resilient. As a result, I aim to achieve a confident, competent transition, feeling both settled in my new environment and aligned with the hospital's standards of care. I view this phase not as an obstacle, but as an opportunity for immense professional and personal growth.
How do you plan to build a professional network and support system within your new team?
Building a strong professional network and support system is essential for both career growth and emotional well-being, especially when transitioning into a new healthcare environment. My plan centers on intentional relationship building, active collaboration, and professional engagement within the team and wider organization. In the initial phase, I plan to start by developing genuine rapport with my immediate colleagues through open communication, respect, and reliability. I believe trust is built through consistency, arriving prepared, offering help when needed, and following through on commitments. During my orientation, I'll make an effort to learn not just about the hospital's policies, but also about each team member's roles and strengths. Taking time to listen and observe will help me integrate smoothly into the established workflow. I also intend to actively participate in team meetings, handovers, and multidisciplinary rounds, as these are excellent opportunities to contribute ideas, learn from others, and demonstrate teamwork. I'll seek mentorship from senior nurses or preceptors, as their experience can provide invaluable guidance in navigating clinical practices and adapting to the workplace culture. I'm not hesitant to ask questions or seek feedback. It's a crucial part of professional growth and helps strengthen relationships based on mutual respect and learning. Beyond the ward, I'll look to join professional organizations, committees, or quality improvement initiatives within the hospital. These not only broaden one's professional exposure, but also foster collaboration across departments. Attending educational sessions, training programs, and social gatherings will further help build connections in an organic way. On a personal level, I plan to maintain a positive and approachable attitude, showing appreciation for teamwork and celebrating small successes with colleagues. Creating such connections enhances morale, teamwork, and patient outcomes. As a result, I aim to establish a network where support, trust, and shared professional values thrive, ensuring I feel both supported and able to support others as part of a cohesive and compassionate healthcare team.
In a new workplace, how will you approach learning the specific protocols and unwritten ways we do things here?
Adjusting to a new workplace involves more than just understanding clinical protocols. It requires learning the organizational culture, communication styles, and unspoken expectations that shape daily practice. My approach combines curiosity, observation, humility, and proactive engagement to integrate effectively into the team and maintain high standards of care. In the initial stage, I plan to familiarize myself thoroughly with all formal protocols and policies by reviewing the hospital's orientation materials, policy manuals, and electronic resources. I will make detailed notes about procedures such as medication administration, documentation, infection control, and escalation pathways. Understanding these systems is essential to ensuring compliance and patient safety. However, I also understand that every workplace has unwritten rules, subtle routines, preferred communication methods, and workflow habits that are not always documented. To learn these, I intend to observe closely and listen attentively to how experienced nurses interact with a multidisciplinary team, handle handovers, prioritize tasks, and communicate with patients and doctors. I'll ask respectful, clarifying questions such as, "I noticed this is done differently here. Could you explain the reasoning behind it?" This approach not only helps me understand the culture, but also shows my willingness to learn and adapt. I'll also seek guidance from my preceptor or senior colleagues, especially during the first few weeks. I believe mentorship is a key bridge between written policies and practical application. I will participate actively in team meetings, safety briefings, and informal discussions, as these often reveal valuable insights into how things truly operate day to day. To ensure I retain what I learn, I'll maintain a learning journal, noting both clinical and cultural observations. Over time, this reflective practice will help me identify patterns, reinforce good habits, and integrate seamlessly into the team's rhythm. As a result, my transition will be both respectful and efficient. I will uphold institutional standards while adapting to the workplace culture, ensuring that my care remains consistent, safe, and aligned with team expectations.
Describe how you would contribute to a positive and supportive work environment on the ward.
A positive and supportive ward environment is essential not only for staff well-being but also for safe and compassionate patient care. I believe that nurses play a pivotal role in creating a respectful, collaborative, and uplifting workplace culture. My approach is grounded in teamwork, open communication, empathy, and accountability. In my previous role in a busy medical surgical unit, I witnessed firsthand how morale and teamwork directly impacted patient outcomes. The situation involved a period when the ward faced high patient acuity and staff shortages, which created tension among the team. Recognizing the strain, my task was to help improve collaboration and maintain a supportive atmosphere despite the challenges. I took action by modeling calm, solution-focused behavior, remaining approachable, and offering help to colleagues when their workload was overwhelming. During handovers or team huddles, I made it a point to acknowledge others' contributions and express appreciation for teamwork. Small gestures like helping with a complex dressing change or taking over a medication round when a colleague was busy fostered mutual respect. I also encouraged open and non-judgmental communication, where everyone felt safe to voice concerns or ask for help without fear of criticism. Equally, I contributed to safety and positivity by adhering strictly to infection control, documentation standards, and professional conduct, setting an example that reliability and positivity can coexist even under pressure. When conflicts arose, I addressed them constructively and privately, focusing on the issue rather than personalities. As a result, the atmosphere gradually became more cohesive, staff communication improved, and we noticed a reduction in errors and missed breaks. The nurse manager later commended our team for resilience and mutual support during that difficult period. I intend to bring that same spirit to this ward, promoting team-based care, gratitude, and shared accountability. I strongly believe that when nurses support one another, we create an environment where both patients and staff thrive.
You are new and unsure about a particular doctor's preference for a procedure or how a certain piece of equipment works. What do you do?
When I encounter a situation where I'm uncertain about a doctor's specific preference or unfamiliar with a piece of equipment, My first priority is patient safety and professional accountability. I believe that acknowledging what I don't know and seeking clarification demonstrates integrity and ensures that care remains accurate, safe, and consistent with organizational standards. In one situation, during my early days in a previous hospital, I was preparing a patient for a minor bedside procedure, and the doctor had a specific preference for how the sterile field was set up, something I hadn't encountered before in my previous workplace. The task was to ensure that the setup met both the physician's preference and the hospital's sterile technique policy. My action was to first review the procedure protocol in a unit manual to confirm the standard practice. I then approached a senior nurse and respectfully said, "I'm new to this setting and want to make sure I follow the correct preparation method for Dr. X's preference. Could you please guide me on how it's usually done here?" By seeking guidance proactively, I not only learned the correct approach, but also demonstrated accountability and willingness to learn. If the issue involves equipment unfamiliarity, such as an infusion pump or monitoring system, I ensure I read the manufacturer's instructions, access the hospital's e-learning modules, or ask for a practical demonstration from an experienced colleague before operating it. I never proceed with a task unless I am confident it can be done safely. I also take notes or request a quick refresher during quieter times so I can independently manage similar situations in the future. As a result, I gained confidence and competence quickly, earning the trust of my team and physicians who appreciated my diligence and safety-conscious attitude.
How do you typically ask for help when you need it, and how do you offer help to a struggling colleague?
In nursing, asking for and offering help are signs of professionalism, not weakness. Patient care is safest when nurses communicate openly and work collaboratively. I've learned that effective teamwork is built on mutual respect, situational awareness, and clear communication. When I need help, I first assess the urgency and nature of the situation. If it's a time-critical matter, such as a deteriorating patient or a procedure requiring assistance, I clearly and directly state what I need. For example, I might say, "Can someone please assist me with this patient's oxygen desaturation? Or could you double-check this medication calculation with me?" I ensure my request is specific and concise so colleagues understand exactly how to support me. If the issue is less urgent, such as clarification on documentation or using new equipment, I approach a senior or more experienced nurse during a calm moment, saying something like, "I want to make sure I'm following the correct process here. Could you show me how it's done on this ward?" This shows accountability and willingness to learn while respecting others' time. When offering help, I always remain observant of colleagues' workload and emotional cues. If I see someone struggling to keep up during a busy shift, I'll approach them with empathy rather than assumptions, saying, "I've finished my medication round. Can I give you a hand with anything? Or would you like me to check on your patient while you finish your documentation?" Offering help in a non-judgmental, collaborative manner promotes trust and fosters a supportive environment. In one situation, during a particularly demanding shift with multiple post-op admissions, I noticed a colleague appearing overwhelmed while preparing for medications. I took the initiative to assist with routine observations and patient comfort rounds, allowing her to focus on medication safety. As a result, we avoided delays, reduced stress, and maintained a positive team dynamic throughout the shift.
You are the nurse in charge of a bay of 6 patients. 2 nurses call in sick, leaving the ward short-staffed. How do you and the team manage this situation safely?
In a short-staffed situation, my first priority would be to maintain patient safety through calm, structured leadership and clear communication. I will begin by taking a quick overview of all patients in the bay to identify which ones are stable and which require higher levels of observation or intervention. I would then communicate immediately with the nurse in charge of the shift or the clinical site manager to inform them of the staffing shortage so that additional help, such as bank, agency, or float nurses, can be requested as soon as possible. While waiting for support, I would lead a quick huddle with the available team members, including healthcare assistants, to reprioritize the workload. Together, we would agree on what is essential, such as medication administration, vital signs, wound care, and responding to deteriorations, and what can be safely delayed or delegated. For example, non-urgent tasks like bed baths or routine documentation might be redistributed or postponed temporarily, while direct patient care remains the focus. I would also ensure that communication among staff is constant throughout the shift. We would check in regularly to update each other on patient conditions and progress, and I would encourage staff to speak up early if they feel overwhelmed. Delegation would be based on competence and scope of practice. For instance, assigning healthcare assistants to monitor stable patients, provide hygiene care, and report any concerns promptly, while registered nurses handle higher acuity patients and critical decision-making. To maintain safety, I would reinforce proper hand hygiene, observation frequency, and timely escalation of any deterioration using early warning scores. I would also keep a clear record of the situation, including staffing levels, the actions taken, and any impact on care delivery, to ensure transparency and accountability. Most importantly, I would support my team emotionally by maintaining a calm, composed manner and showing appreciation for everyone's efforts. At the end of the shift, I would ensure a proper handover, report the incident formally, and participate in any debriefing to reflect on how we managed and how systems could better support us in the future. This approach helps maintain safe, prioritized care, upholds team morale, and demonstrates professional accountability even under significant pressure.
You are the nurse in charge of a bay of 6 patients. 2 nurses call in sick, leaving the ward short-staffed. How do you and the team manage this situation safely?
If a patient tells me that their medication looks different from what they usually take, my immediate action would be to pause and not administer the drug until I have verified its accuracy and safety. Patient concerns about medications are extremely valuable, as they often serve as an additional safeguard in preventing medication errors. I would start by reassuring the patient in a calm and professional manner, saying something like, "Thank you for letting me know. I'll double-check this to make sure it's the correct medication for you." I would then review the prescription order, the medication label, and the patient's medication chart or electronic record to confirm the name, dose, and route of administration. If the medication appears different in shape or color, I would also consult the pharmacy reference guide or contact the pharmacist to verify whether the hospital has changed suppliers or formulations, which can occasionally explain such differences. If any discrepancy or uncertainty remains, I would withhold administration and immediately escalate the issue to the prescribing physician or pharmacist for clarification. I would document the situation clearly in the patient's record, noting that the medication was withheld pending verification. Once confirmed, I would return to the patient, explain the findings clearly, and provide reassurance before administering the drug. For example, during one of my shifts in the medical surgical ward, a patient on long-term antihypertensive therapy noticed their tablet looked smaller than usual. After verifying with pharmacy, we discovered that the brand had changed, but the active ingredient was the same. The patient appreciated the transparency, and it reinforced my belief in collaborative, patient-centered care and the importance of double-checking every medication, even when it seems routine. This approach not only ensures medication safety, but also promotes trust and open communication between the nurse and the patient, both essential aspects of professional nursing practice in international settings.
A patient with limited English proficiency is nodding and smiling as you explain their discharge instructions, but you are not confident they have understood. What do you do to ensure a safe discharge?
If a patient with limited English proficiency appears to nod and smile during discharge teaching, but I suspect they have not fully understood, my immediate responsibility is to ensure comprehension before discharge, as patient safety and continuity of care depend on it. Simply assuming understanding based on nonverbal cues could result in medication errors, complications, or readmission. First, I would pause the conversation, adopt a respectful and reassuring tone, and gently clarify by saying, "I just want to make sure I've explained everything clearly. Could you please tell me how you will take your medication once you get home?" This teach-back method allows me to assess their understanding by asking them to explain instructions in their own words, rather than relying on yes/no responses or gestures. If it becomes clear that language is a barrier, I would immediately access interpreter services, either in person, by phone, or through a video link, depending on the facility's policy. I would avoid using family members as interpreters, especially for medical information, because of confidentiality and accuracy concerns. With interpreter present, I would re-explain the discharge instructions step by step, including medication schedules, follow-up appointments, and red flag symptoms to watch for. I would also use visual aids and written materials translated into the patient's preferred language, supplementing verbal explanations with simple diagrams or pictures. For instance, I once cared for a middle-aged patient being discharged after a laparoscopic cholecystectomy whose primary language was Arabic. Initially, she nodded in agreement, But through the teach-back process and interpreter assistance, I discovered she had misunderstood the wound care instructions. After clarifying with translated materials and demonstrations, she verbalized correct understanding, and her recovery was smooth. Finally, I would document all steps taken, use of interpreter, patient's demonstrated understanding, and materials provided to ensure legal and professional accountability. This approach aligns with international standards of culturally competent and patient-centered care, ensuring that every patient, regardless of language barriers, is discharged safely and with full understanding of their care plan.
You walk into a patient's room and find them unresponsive and not breathing. Describe your immediate actions and the sequence of events you would initiate.
Upon finding a patient unresponsive and not breathing, my immediate priority would be to initiate the basic life support (BLS) sequence while ensuring the safety of both the patient and the team. Remaining calm and focused is critical in these situations, as early and effective intervention directly impacts survival outcomes. First, I would quickly assess the situation by checking for hazards, then approach the patient, call their name, and gently tap their shoulders to confirm unresponsiveness. Once confirmed, I would immediately shout for help and activate the emergency response system, pressing the resuscitation or code blue button and requesting assistance from the rapid response or resuscitation team. At the same time, I would instruct any available staff member to bring the crash cart and defibrillator. Next, I would assess for normal breathing and pulse simultaneously for no more than 10 seconds. Finding no pulse and no breathing, I would begin chest compressions immediately, placing my hands at the center of the chest and delivering compressions at a depth of about 5 to 6 centimeters, at a rate of 100 to 120 per minute, allowing full chest recoil between compressions. If trained personnel are present, we would alternate roles every 2 minutes to avoid fatigue. As soon as the defibrillator arrives, I would apply the pads and follow its prompts to analyze rhythm. If a shockable rhythm, such as ventricular fibrillation, is detected, I would ensure everyone is clear of the patient before delivering the shock, then resume CPR immediately for another 2 minutes before reassessing. If non-shockable, compressions would continue uninterrupted, with airway management and ventilation using a bag valve mask connected to oxygen. Meanwhile, I would delegate specific roles, one nurse to record events and times, another to prepare emergency drugs such as adrenaline 1 milligram for every 3 to 5 minutes, and another to assist with airway management. Once the resuscitation team arrives, I would provide a concise handover using the SBAR format, summarizing the situation, time of collapse, interventions performed, and any known medical history. Following the event, I would assist in post-resuscitation care or, if the patient does not survive, support the team and family while completing necessary documentation and debriefing.